What's up, guys? Dr. Joey Seaforth here, physical therapist, athletic trainer, and strength and conditioning specialist. Today, I want to look at the effects of imaging, such as x-rays, MRI, on pain and function. Before we get into it, guys, please like and subscribe. It helps me grow the channel here and pump out content for you guys. And please leave any comments that you guys want for future videos. Appreciate all the help. Thank you. So let's get into the research. First study up looked at abnormal findings in 230 knees that were tested with MRI. 97% of these knees found abnormalities in the imaging, such as meniscus tears, ligament ruptures, bone edema, tendonitis, and the list goes on and on and on. The important thing is all these participants were asymptomatic. They had zero symptoms. Big takeaway from this study is there can be a lot of scary things that are considered wrong on your MRI, but they don't correlate with pain or function. All of these individuals in this study had zero pain and are able to live their lives normal. So let's get into the next study. The next study looked at the prevalence of symptomatic and asymptomatic rotator cuff tears in the general population, basically having pain versus not having pain. Rotator cuff tears are one of the most common things diagnosed when people go see orthos for shoulder pain, especially as they get older. Let's talk about the findings in this study. 147 out of 664 subjects had a full thickness rotator cuff tear. So we're talking a big tear in that muscle. Of those, 35% had symptoms and 65% had zero symptoms. So let's think about that. Full thickness tear, 35% had symptoms, 65% did not have symptoms. As you can see from the picture, rotator cuff tears went up as people were getting older in the study, as well as asymptomatic patients that were having these same rotator cuff tears. The data revealed that rotator cuff tears did not always cause shoulder symptoms, and in more people than not, as we could see in the graph, did not experience pain. It's also important to note that the study only looked at 2 out of the 4 rotator cuff muscles, and a hypothesis that was discussed in the study was that the rates would be even higher if they were able to look at the other 2 rotator cuff muscles. Last study we're going to talk about today is everybody's favorite, low back pain. It looks at imaging and low back pain and the correlation between pain and function. It found that 5 to 10% of all low back pain is due to underlying spinal pathology. The remaining 90 to 95% had no indications of a serious cause and should be managed by conservative care, aka PT, exercise, chiropractic care, etc., etc., etc. Treatment for most causes of back pain is the same whether you're doing imaging or not, and was found that unnecessary imaging often led to a delayed recovery. Another figure that was discussed showed the percentage of people with a disc bulge, as well as the percentage that did not have pain. And as you can see in this picture, 30% of 20-year-olds did not have back pain, 40% of 30-year-olds, 50% of 40-year-olds, 60% of 50-year-olds, 69% of 60-year-olds, and 77% of 70-year-olds. That's a lot of people with a disc bulge. The important thing to note is they did not have any pain. Once again, another study backed up that pain and function is not correlated with imaging. So after looking at all these studies, we talked about how imaging doesn't necessarily correlate with pain and function, but that's not to say that all imaging is bad. There are definitely times where imaging is important, and this is where I've utilized it in the past. I've had a woman in her 70s come in after slipping on ice, and we're sending her off for imaging and making sure that she doesn't have a fracture of her hip. I've had that athlete that's come into the clinic who hasn't been able to bear weight on their ankle, and it's been 3 or 4 days, and we found out that they have a fracture. You know, you have that kid who got hit at a lacrosse practice 2 nights before, and they're coming in and they're not following your signals and you're testing cranial nerves, and you're like, you know what? Let's go get this looked at. So there definitely is a time and place for imaging. It should not be as much as what the healthcare system does currently. Everyone knows someone who has been told, oh, I have bone on bone in my knee, I need to get my knee replaced. Or I've had 16-year-olds come in to see me that do gymnastics, and they're like, I got an x-ray of my back and it says that I have a back of a 90-year-old. And I have people that get imaging as they get older. I had an individual who had knee pain. I was almost certain that he had meniscus tear, but we were working through it. After 2 months, he was back to everything, running, stairs, everything that he loved to do. He went in for a follow-up. They did an MRI, and they found a meniscus tear. Immediately, his demeanor changed and he thought that he was going to have to get surgery. And I told him that no, all the progress that he's made, he does not need surgery. Imaging can be good, but it also can be bad at the same time. And if you want to compare imaging to other things, as you get older, imaging is going to look worse and worse, quote unquote, but that's a normal part of aging. Think as changes on MRIs and x-rays as wrinkles, gray hair, white hair as we get older. These are all normal parts of aging. Thank you for listening to my talk on imaging and pain and function. And please let me know in the comments if you guys want any other stuff on imaging or whatever else you guys are interested in to make content on. Thank you.